Good morning, friends. This is Goswami from Institute of Language Teaching, English Medium, B.Ed College, Rajkot. Today we are going to learn mental health. We will cover concept and definitions of mental health, concept of mental disorder, characteristics of mental health, affecting factors and remedies for mental health. By the end of this lesson, you will be able to define mental health and mental disorder, know the characteristics of mental health, know the factors that affects mental health, and remedies for mental health. Let's begin with the concept. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history of mental health problems. Mental health problems are common, but help is available. People with mental health problems can get better and many recover completely. Let's have a look at the definitions of mental health. As Crow and Crow mentions, mental hygiene is a science that deals with human welfare and pervades all fields of human relationships. According to the WHO, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. The World Health Organization stresses that mental health is not just the absence of mental disorder. Means, if someone is not mentally disturbed, we cannot say that he is mentally healthy. Mental disorders include anxiety, depression, schizophrenia, and alcohol and drug dependency. Common mental disorders can result from stressful experiences, but also occurs in the absence of such experiences. And also, stressful experiences do not always lead to mental disorders. It depends upon person. Many people experience sub-threshold mental disorders, which means poor mental health that does not reach the threshold for diagnosis as a mental disorder. Mental disorders and sub-threshold mental disorders affect a large proportion of populations. The less commonly used term, mental illness, refers to depression and anxiety, also referred to as common mental disorders, as well as schizophrenia and bipolar disorders, also referred to as severe mental illness. In countries around the world, a shift of emphasis is needed towards preventing common mental disorders such as anxiety and depression by action on the social determinants of health as well as improving treatment of existing conditions. Action is needed as many of the causes and triggers of mental disorder lie in social, economic, and political spheres in the conditions of daily life. Educators are often the first to notice mental health problems. Here are some ways you can help students and their families. What educators should know. You should know the warning signs for mental health problems, whom to turn to, such as the principal, school nurse, school psychiatrist or psychologist, or school social worker if you have any questions or concerns about students' behavior. How to access crisis support and other mental health services. Consult with a school counselor, nurse, or administrator and the student's parents if you observe one or more of the following behaviors. If the student is feeling very sad or withdrawn for more than 2 weeks, if he is seriously trying to harm oneself or making plans to do so, sudden overwhelming fear for no reason, sometimes with a racing heart or fast breathing, involvement in many fights or desire to badly hurt others, severe out of control behavior that can hurt oneself or others, not eating, throwing up, or using laxatives to make oneself lose weight, intense worries or fears that get in the way of daily activities, repeated use of drugs or alcohol, extreme difficulty concentrating or staying still that puts the student in physical danger or causes problems in the classroom, severe mood swings that cause problems in relationships, drastic changes in the student's behavior or personality. If you find one of the following causes in the student, you can get to the counselor, principal, or the student's parents too. Now let's have a look at factors affecting mental health. The first one is self-esteem. If the student is having low self-esteem, then will be having negative thoughts, anxiety will be at the high level and the performance will be poorer. That will result into failure, and then the last stage will be self-blame. And in contrast, if he is having high self-esteem, then the thoughts will be positive, anxiety will be less, and performance will be at the highest. This can lead to the success, and it will lead to the self-motivation. So this is the value we place on ourselves, our positive self-image and sense of self-worth. People with high self-esteem generally have a positive outlook and are satisfied with themselves most of the time. The second factor is feeling loved. Children who feel loved, trusted, and accepted by their parents and others are far more likely to have good self-esteem. They are also more likely to feel comfortable, safe, and secure, and are better able to communicate and develop positive relationships with others. So feeling loved at home and as well as school is very much important for each and every child. The third one is confidence. Youth should be encouraged to discover their own unique qualities and have the confidence to face challenges and take risks. Young people who are brought up to have confidence in themselves are more likely to have a positive attitude and to lead happy and productive lives. So a child must be confident enough to face his everyday activities. The third one is family breakup or loss. Separation or divorce or the loss of a parent or sibling is extremely painful. Finding ways to cope and adjust to the changes brought by these events is critical for everyone, but particularly for the youth. How grief is handled can affect young people negatively for years to come. If children are having difficulty coping, professional help is recommended over there. A psychiatrist or psychologist should be considered for these children. The next one is difficult behavior. When people are unhappy, they either internalize their unhappiness or act out. The latter usually appears as bad or difficult behavior, such as using abusive language, being aggressive or violent, damaging property, stealing, lying, refusing to comply with requests or expectations at school or home, or displaying other inappropriate actions. If such behavior is serious and persistent, the young person and his or her family might require professional help. And the last one is physical ill health. Disease, injuries, and other physical problems often contribute to poor mental health and sometimes mental illness. Some physical causes such as birth trauma, brain injury, or drug abuse can directly affect brain chemistry and contribute to mental illness. More commonly, poor physical health can affect self-esteem and people's ability to meet their goals, which leads to unhappiness or even depression. In such cases, receiving the best possible treatment for both the physical problem and the resulting psychological consequences is key to optimal recovery to good mental health. Next is abuse. The mental health of abused children is at great risk. Abused children are more likely to experience mental disorders or mental illness during childhood and into adulthood. Abuse may be physical, sexual, psychological, or verbal. It may not always be evident or easily recognized. Regardless of the form of it takes, abuse cannot be tolerated. Children need to be protected from abuse and helped to overcome its negative effects. Abuse can cause feelings of low esteem, lack of self-confidence, depression, isolation, and anger. All feelings that impair a child's chance to live a happy life. Now, what educators can do in classrooms and schools? You can support the mental health of all students in your classroom and school, not just individual students who may exhibit behavioral issues. Consider the following actions. Educate staff, parents, and students on symptoms of and help for the mental health problems. Promote social and emotional competency and build resilience. Help ensure a positive, safe school environment. Teach and reinforce positive behaviors and decision making. Encourage helping others. Encourage good physical health. Help ensure access to school based mental health supports.